I'm Dr. Ava Frick, the Veterinary Medical Director of Electromedical Products International. It's the home of Alpha-Stim technology. I want to review with you the protocol because just as important as the waveform is the protocol steps that have been designed to use the microcurrent electrical therapy. It's a 5-step protocol, and once you learn the protocol for any part of the body, it's the same thing that you're going to apply for another part of the body. So the 5 steps are very simple. When there is, number one, when there is an area of the body, so we're going to pretend like the problem is in her back. So when we have an area of problem, we don't want to just start treating right here. We want to treat beyond that area. So first off, we're going to make a big X. And everything initially is done diagonally. So I'm going to start on opposite sides of the back. So her spine is running here. I'm going to be far enough on either side, so we're looking at about 2.5 inches, that this current and this waveform can move through the area of where the spinal cord and the discs are. And this would be 20 seconds. Then we're going to do the opposite side. So we want to be equal here. So then the X is going to go to the opposite side. And that would also be 20 seconds. So that's our introduction, the first step, the big X, to actually bring all of this other tissue that's affected by the area of problem into the game that we're going to play, which is taking out the swelling, the edema, addressing the pain, those things that are associated with that. All right, so now we're going to get a little closer in. So now we're going to do what's called the star pattern, which is basically creating an asterisk. So we're going to have a smaller X. These would each be 10 seconds. So we're always going to be alternating to the opposite side. And then we're going to make some even smaller X's from there. So we're creating that asterisk again. So we've started going straight through. Now we're going to change that angle just a little bit. So I'm going to be higher on one side and lower on the other. Again, these are 10-second treatments. We're going to alternate those going down the back through that area of concern. And now I'm going to shift. Now I'm higher on the left side and lower on the right side. So if you think about an asterisk, that's exactly what we're creating. So those would each be 10 seconds. So now I've addressed the big X. We've done the star pattern. And the last thing is going to be connecting the two sides. So with the back, it's just going to be 4 points. So I'm going to do 10 seconds up here behind the shoulders. Then I would move down a little ways, another 10 seconds. And these are lateral, straight across. We're not doing them at a diagonal. And then a third one. And then a fourth. So just to review the 4 steps that we've done so far, number 1 is the large X. Number 2 is creating the star pattern. There would be a third step of treating the opposite side if this was doing a leg. And then the last step is connecting the two sides. That's number 4. And then the last step after that is going to be to apply the ear clips. So we would put the ear clips on. It would be connected in. You do your ear clips. And that part then is another 20 minutes. So that's the protocol that we use for all of our treatment patterns for doing microcurrent electrical therapy. This can then be applied to a bad hip or a knee or a shoulder, any other part of the body.